Fantastic news. The MHRA, the fiercely independent regulator, has clinically authorised the vaccine for rollout. The NHS stands ready to make that happen. So from early next week, we will start the programme of vaccinating people against COVID-19 here in this country. As we know from earlier announcements, this vaccine is effective. The MHRA have approved it as clinically safe, and we have a vaccine, so it's very good news. Now, you mentioned the -70 conditions that it needs to be stored in, so this is a challenging rollout, and the NHS in all parts of the UK stands ready to make that happen. They're used to handling vaccines and medicines like this with these sorts of conditions. It's not easy, but we've got those plans in place. And this morning I spoke to my counterparts in the devolved nations to make sure that we are all ready to roll out this vaccine.
Early next week, I'm guessing, hoping that might be Monday. I'm sure you'll correct me if it isn't. But -70, that means that you're not going to be able to get it from your GP. So there's going to have to be specialist centres. Are they like the Nightingales are going to be turned into specialist centres?
Well, there'll be a combination of 3 modes of delivery. The first is hospitals themselves, which of course have got facilities like this, and 50 hospitals across waiting to receive the vaccine, as soon as it's approved, so that can now happen. And then there'll also be vaccination centres, which will be, as you say, big centres where people can go to get vaccinated. And they're being set up now. And then there'll also be a community rollout, including GPs and pharmacists. Now, of course, because of the -70 storage conditions of this vaccine, they will be able to support this rollout where they have those facilities, but they'll also be there should the AstraZeneca vaccine be approved, because that doesn't have these cold storage requirements, and so is operationally easier to roll out. But I just want to thank all of the scientists at BioNTech and Pfizer who are manufacturing this, who we've worked so closely with, and we're the first country in the world to have a clinically authorised vaccine to roll out.
That's absolutely amazing, and what a relief for so many people watching today. We know the order of people. You've told us many times who will get this vaccine. But I want to just put this to you, if I may. People with learning difficulties, 6 times more likely to die from COVID. Will they be on the list as some of the early people to get this vaccine?
Yes, the Joint Committee on Vaccinations and Immunisation is the clinical committee that advises the government on the priority and who gets the vaccine in what order. They will be setting out details of that prioritisation later this morning, along with the MHRA, who will set out the clinical details behind this vaccine and why they've taken the decision to authorise it. So that will happen mid-morning, so that people can see all of the details, and also that prioritisation, which is set out according to clinical need. As you know, we've been supporting people who are clinically extremely vulnerable to COVID throughout this crisis, and the JCVI will be setting that out in detail.
OK, which brings me to vaccine passports. Michael Gove says we don't need them. One of your other colleagues, George Eustice, says that we will. Not George Eustice, forgive me. It was Nadeem Zahawi, of course, wasn't it? Do we need a vaccine passport when we've had it in order to get access to pubs, restaurants, places of worship, I don't know, wherever else it might be? Do we need a vaccine passport?
Well, that isn't part of our plan, and one of the reasons is that while we know that this vaccine protects you from getting ill with COVID, we don't yet know how much it stops you transmitting COVID until we've rolled it out broadly. We'll, of course, be monitoring that very carefully, and therefore we will vaccinate according to protecting the people who need the protection most, according to those who are vulnerable from COVID. So that isn't part of the plan. The plan is to get this rolled out according to the clinical prioritisation that my formal advisors will set out later this morning.
So we might need a vaccine passport, but not yet. Is that what you're saying?
It's not part of the plan. The plan is for the NHS to roll out this vaccine now that we've got it, and start that early next week and do that according to clinical priority.
OK, let me just ask you this about your former buddy, your former neighbour. Apparently you gave him a gig creating plastic vials for this COVID test kit, tens of millions of plastic vials. Chatted to you over WhatsApp. He's never had any experience of it previously. What's all that about?
Well, there's an awful lot of people who've come forward to support the nation in our battle against COVID. And a constituent of mine came forward and approached the government and went through the normal channels, and of course I'm very pleased with and grateful to all those who've come forward. So I had nothing to do with this contract. I don't have anything to do with the signing of individual contracts. What I am though pleased about is the number of people who've come forward, whether it's PPE or on the testing, who've stepped up in the nation's hour of need, and so I'm very grateful to all of them.
You mentioned your step-grandfather, Derek, in the House of Commons yesterday. He sadly has died as a result of COVID-19, and we offer our sincere condolences from everyone here at Sky News. How has that changed your approach to your work?
Well, thanks for raising it. You know, I have a big and complicated and loving family, and you know, losing a member of your family is obviously a big thing for anybody, and it's just made me more determined, Kay. You know, this is a horrible disease, and I've hated seeing so many people suffer from it, and it just really brings it home to you when it's a member of your own family. And you know, the work that we're all doing together, abiding by these rules. I know that the rules are frustrating, and I know that you can have debates about some of the boundary issues, but the thing about the rules is they're there not to push the boundaries. They're there as to tell us what are the limits of behaviour that can keep people safe. And it just underlines how important it is for people to abide by these rules. And you know, this morning we've been talking about the amazing news on the vaccine, and that is the hope. You know, help is on its way, but we've still got to get from here to there, and we've got to keep people safe in the meantime. You know, Derek was in his 70s, and people are vulnerable to this disease. It hasn't gone away. It hasn't lessened in its potency, and it can still take people away from everyone's family, and it strikes. You know, it can strike anybody. So we've got to stick at it. We've got to stick together. I know it's frustrating. I'm really glad that the new measures were passed with a 3-figure majority in the House of Commons last night. And I ask everybody to not only abide by the tiering rules, but respect the personal responsibility all of us have to try to reduce the transmission of this virus, because we want to, especially with the end in sight, and now that we've got this vaccine actually being delivered next week. Yeah.
You talk about what happened in the House of Commons yesterday. You can't really call it a victory, can you? I mean, so many MPs, new intake MPs as well, decided that they wanted to not support the government. And apparently the Prime Minister standing in the corridor pleading with these new MPs to vote in his favour. I mean, how very unedifying.
Hardly. That's what we do when there's a tight vote.
It's not what the Prime Minister does, surely.
You know, people. Oh yes, and people, you know, wrestling with their consciences. Actually, these are really big decisions. I respect the decisions that people made, But actually, it was an overwhelming majority, a majority of 213 in favour of this action. So I'm really glad that the House of Commons has passed it so overwhelmingly, and that shows to the country that we need to all abide by these measures, and we need to stick with it. Let's stick with it, because help is on its way. We can now see the way out, and we can see that by the spring we're going to be through this. We're going to be through this, but let's not let up and lose our resolve now. Let's hold on to it, look after ourselves, follow those rules that, as you say, the House of Commons passed so convincingly last night and overwhelmingly, and then we'll get through this as safely as we can, and then get on the road to recovery and, as the Prime Minister puts it, build back better.
Out of this by the spring, bold claims. Let's see if that's the case or not. I want to ask you about Scotch Egg Gate before I let you go. It seems funny to some, the paper's making fun of it this morning, but for many people in the hospitality industry, it's very, very serious. They face huge fines if they don't get this right. We don't know what a substantial meal is and what it isn't. Even the government doesn't know. Tell me, is a Scotch egg a substantial meal?
Well, a substantial meal is a well-established concept in hospitality.
Yeah, but what does it mean to you?
And so people, of course, a scotched egg that is that's served as a substantial meal is a substantial meal. And I come back also to the broader point, Kay, which is, let's not have a pick at these boundary issues. What we need to do is not try to push the boundaries. We all need to take responsibility for our own actions.
And to that end, we need to be guided by our politicians. And our politicians are giving us different answers to a very simple question about whether a Scotch egg is a substantial meal. And do you have one? Do you have two? Well, it just seems almost absurd. Why don't you just tell us what the rules are and we can abide by them, and then people won't get a £10,000 fine?
Yes, and Kay, I'm telling you what the rules are. The rules are that a substantial meal is a well-established principle in hospitality. People in the hospitality trade know what a substantial meal is because it is a standard way of describing the two different types of hospitality. Those that serve meals and those that don't. And so a starter can be a substantial meal. You can have a Scotch egg as a starter. But I just want to get away from this sort of the picking at the boundaries, because there's a much, much bigger and more important thing going on, which is everyone has a responsibility to act carefully, not to push at the boundaries of these rules, but to live within these rules until we can get enough people vaccinated that we can lift the rules altogether and we can all get on. That's what we all need to do.
You can push at the boundaries, which is what we do as a nation, and still live within the rules as long as you know what the rules are. Which brings me to my final question. Can you have, wet pubs have to close at the moment, can you have a takeaway delivered to a wet pub, which apparently, this is a serious question, quite a few pubs in central London are planning to do that. They're planning to have McDonald's, other takeaways are available, delivered to the pubs so that their guests can eat those takeaways indoors. Is that allowed?
We've set out very clearly the principles and in law what is and isn't expected. And if you break that law, it's set out really clearly.
Is it breaking the law or not?
It's for the courts. Yes.
Please answer my question, Health Secretary. It's so important to all of these people. It's their livelihoods.
It's also the law. And we passed the law in Parliament, and we passed it last night, and it is for the courts to interpret on each individual case. But what I'd say is that people should not only respect the law, absolutely will enforce against these laws.
OK, so this is my question. It's a serious question. I know you've got to go. It's really important. Can I eat a takeaway in a wet pub?
The law was passed last night. If people break that law, then they'll end up in court.
Can I eat a takeaway in a wet pub?
Hey, I'm being absolutely clear with you.
You don't know, do you?
The role of Parliament is to pass the... I know that it's a matter for the courts depending on the individual circumstances
So what does
of
the law
each
say?
individual
Can you eat a
case.
takeaway
And it doesn't
in
matter.
a wet
It doesn't
pub?
matter. Okay, it doesn't matter how many times you interrupt me. I'm going to tell you what the answer is, and the answer is that the courts interpret the law that's set by Parliament for this country. The law has been set last night. If people break that law, then it's for the courts, based on the individual circumstances, to determine that. But there's a bigger principle at stake, okay?
This is really important. This is people's lives. This is people's lives. This is people's lives. What does the law say about eating a takeaway in a wet pub? Please just answer the question.
The law says that it is okay to have a takeaway, and then it is for the courts to interpret whether that is what is actually, in fact, happening in each individual case. Since you haven't given me an individual case, and since that it hasn't happened,
I'll give you an individual case. The gay pub in central London, in Soho, says that they are going to allow their clients to eat McDonald's to be delivered into their pubs so that they can open it. Is that acceptable or not?
Well, I don't think it's acceptable to try to push the boundaries of these rules, and it's a matter for the courts to interpret the law.
OK, good to talk to you. I know you've got to go, and fantastic news about the vaccine. That is amazing news. Thank you so much for joining us this morning. Always appreciated.